Dr. Shawn, how should patients think about the cost of this?
That's one of the most important decisions for people because you have to figure out how this is going to fit into your life.
Right.
But I also like to tell people most of our patients are financing this procedure. We try to make it very available and very possible for them to get this done if this is what they deem very important in their life.
Well, and how does it compare to previous dental work that they've already been having, like price-wise?
So it's the thought process of we're replacing all of the teeth.
Right.
So if you imagine if you've had work on a single tooth and the cost of that, if we were to go and replace every tooth in the mouth individually, I mean, that's a $100,000 procedure.
Easily.
If not more, yeah. The way that we're doing it with 4 to 6 implants, we're able to cut that cost considerably down and still get you the same function and the same type of teeth.
And it seems like even better than what they had before.
Typically, it's considerably better because it's actually solid. It has some foundation to it,
right.
and it lasts.
Wow, that's incredible. Okay, but speaking about how long it lasts, like how long does this last? Is this a lifetime solution?
For most of our patients, this is a lifetime solution. I always say, now you've got to take care of it, of course.
Right.
But you wouldn't make this life-changing or have this life-changing procedure if you weren't going to take care of it, if it wasn't going to change your life. This is your new baby. So.
Right. Can you share a story about a patient that you've recently worked with?
Yes, absolutely. So we had this patient come in, and actually she was kind of pulled in by her daughter. It was amazing. It was wonderful to see how much the family wanted this for her. And so she was really nervous and very scared and very embarrassed, but the daughter kind of pulled her in the door.
Sweet of the daughter.
Yeah, it was amazing to see. And so we did our initial consult, and she was still kind of not sure. She was very nervous and apprehensive, and the daughter actually said, "No, you're getting this done." And it was wonderful to see that because this is something that changes the whole family. If you imagine somebody—
family pictures.
Yes, family pictures.
Right?
I always think of Sunday meals with the family, right? Like this is everything that your family wants from you. They want you to communicate and be involved in their life.
Well, they want to see you smile.
They want to see you smile.
Not hiding your smile.
Absolutely.
That's amazing. Okay, so if you had a family member who needed this, what would you tell them to do? What would be the next steps?
Well, first of all, I think it would be really important to figure out what's best for you. If this is actually what you need, make sure that we're in the right place and that you've got everything that qualifies you as a good patient for All-on-X.
Right.
But the next step would be making a phone call, for sure.
Okay, well, and the number is on the screen at any point. Anybody can call in and find out what they need to know for themselves. But what's the myths around this? Like all the different theories and things out there that might be scary for a patient. What would you say those myths are, and how would you talk a patient through that?
Well, I know we've already talked a little bit about pain and the difficulties of recovery, but I think another myth would be that, I'm not a candidate. Mm-hmm. Most people are really concerned that they've heard no all their life with their teeth. Something's wrong. They've had the tooth has just crumbled and disintegrated on them, and the dentist has said, "No, I'm sorry, you need to get that tooth extracted." Mm. And so they come in with a lot of apprehension, thinking that this is just not going to be something that's going to work for them.
Right.